I've been asked a few questions. So here are some of my responses. Um, Somebody asked, what is a cochlear implant or hearing aids or assistive devices for deaf children? So basically, they are assisted devices. They're a way to help access the auditory brain. So when a deaf child cannot hear, the auditory brain, the listening part of the brain is sleeping, if you like. And if it doesn't get the stimulation early in life, the brain can actually start using it for other things, because the brain likes to make sure um, the brain is used in the best way. So it's called pruning. So it actually um, decides to use part of the brain for something else if it's not used. So that's why we have such a very little window of time to do this. And ideally, it's all before the age of 3.5, because the brain has maximum what's called neuroplasticity. If you think of the plastic that is movable, before 3.5 years old, it has maximum neuroplasticity. There is still plasticity after that in childhood, but that's the most plastic time where the brain can be molded. So early diagnosis is so important. So the first thing, even for a very profoundly deaf child, we might put hearing aids on just to keep the auditory brain stimulated. So that's why it's so important. Even a very tiny young baby, if the newborn screening test is done and they find that the baby has a hearing loss, then from the ABR test, the auditory brainstem response test that audiology carries out, they can set hearing aids for that loss. For children up to a severe hearing loss, we usually find hearing aids can help. There are also other assisted technology devices, such as a bone-anchored hearing aid, which actually sits on the skull, and that works by missing out the outer and middle ear and going straight into the inner ear and sending the messages to the brain. As a bone anchored, normal hearing aids, they sit with a little ear mold in the ear and a hearing aid on the back. Important, of course, we use them all waking hours. The brain needs to be listening all waking hours. You might find you need to work with your child and with your auditory-verbal therapist in trying to keep them on without making it a battle. Cochlear implants are a little bit different, and cochlear implant is surgically, so the cochlear implant surgeon has to surgically, when the child is sleeping, go in behind the ear and implant the electrodes round the cochlea. And then 22 little electrodes go from there, and it's a little bit like a very, very powerful hearing aid that's implanted in the cochlea, the little inner ear part of the ear that's like a little snail shape, and it sends messages to the brain. Now, initially, the child doesn't understand what this sound is. No, they don't understand speech. So we have to help the child learn to listen. And there are certain techniques that we could use. So that's a cochlear implant. That's how it works. What to expect after the cochlear implant? So there'll be a time of healing, and then you go back in And the qualified audiologist who's qualified in programming the cochlear implant will do what's called switch on. Now, when they switch it on, they switch the cochlear implant on, they might do it quite conservatively because we don't want to blast the child with a very loud noise. They start to switch on. The child might not react at all. That's one possibility. Child might react and be a bit startled and not like it. That's another possible reaction. Or sometimes the child listens and quite likes it. But it's a very varied reaction. So don't worry about first reactions. If the child doesn't make any reaction, don't worry about that either. The audiologist will set the hearing aid, the cochlear implant first at a certain program. They might ask you to come back, I don't know, a month later. Different organizations do it in different ways. Here, they set it conservatively the first time, and then ask you to come back and then start to increase a little bit. Now, what to expect? Do not expect your child to start talking straight away. Think of a baby. When the baby is born, is the baby carrying out a conversation? No. We're going to be thinking about the hearing age, or sometimes we call it the listening age of the child. So if the child has been listening for 1 month, 2 months, 3 months, we don't expect that baby of 6 months old to start having a conversation. But we're going to start helping that child to listen. And there's different ways to do it. The worst thing you can do is shout. Do not shout. Shouting is the worst thing you can do. Just talk to your child. Just talk and chat normally. Next question. Yes, I think I explained this in my last video, but difference between speech therapy and auditory-verbal therapy. Well, first thing is an auditory-verbal therapist has to have a very good knowledge of audiology and understanding of how sound gets to the brain. So I heard recently about a little boy who had been implanted in June and had attended speech therapy every day. But strangely, the speech therapist never noticed that the child wasn't wearing his cochlear implant processor, which sits on the magnet on the back of the head. I have no idea what the speech therapist was doing when a child was not using the technology. Secondly, so that's the first thing, they have a very good understanding of audiology. They have a good understanding of what's called the listening hierarchy, how a child learns to listen, how a child learns to talk, how a child learns to understand. But secondly, if a parent is not involved, not just sitting in the corner, but involved in a therapy session, it is not ABT. I hope that makes sense. Those two, for me, are the two main differences. Speech therapy might focus very much on the particular sounds a child is saying. At the start, AVT is focusing on understanding and on the expressive of how a child is expressing themselves. When can I expect my child to say mama or their first word? And that is what everyone is looking for. More importantly, we need to be thinking of when a child starts understanding that the word mama means that lady, that mummy over there. That's mama. Understanding must come first. So first they're going to hear mama and understand that that is mummy. So mummy over there, or mummy beside me, or mummy carrying me, that's her name, mama. So first I would be looking for, does she understand or he understand the word mama? When he understands the word mama, and he begins to understand other things, his first word will come after that. We're looking for 50 words of understanding before you say your first word. When your child has been switched on with cochlear implants, or when your child has been given hearing aids, I say focus on helping your child understand spoken language. Then, when they've understood 50 words, you will hear their first word. And it won't come out necessarily perfectly. It might come, as we say, an approximation. Now, what is mapping of a cochlear implant? Mapping is programming. That's another word. So some of you might have seen an audiogram of your child's your child's hearing loss. The programming is trying to get your child to hear within what's called the speech banana. We need it, or at the top of the speech banana, so that they can hear all the speech sounds. Mapping is absolutely crucial. It doesn't just happen once, finished, done. It keeps happening. So all through that first year, you're going to be getting mapped to maybe several times until they've got it correctly done. That's just part of what happens. It's a programming. How many times should my child see an audiologist after the implant? That can change according to the child. And different organizations have it in a different way. We usually say here in Ireland, you're mapped, switched on, then you come back a week or two later to get a different programming to see if it is working. Then you come back again, maybe a third time. So you might go several times in the first 6 months. Then when we start to get what's called a stable map, we start understanding what the map is, then you can go less often. But really the audiologist would guide that. How many therapy sessions per week should I attend? I think we need to think in terms of what you need. And that's what you and the therapist talk together. At the start, parents know, I want my child to develop spoken language, but I don't know how. So the first thing you're going to be doing is talking to the speech therapist who is training in auditory-verbal therapy and thinking, okay, so what are we aiming for? Where are we going in the first 3 months? Where are we going in the first 6 months? And then we break it down into little small goals. Where are we going for this week? So my suggestion is either once a week or once every 2 weeks, because the important thing happens in the last 5 minutes of an AVT session. The last 5 or 10 minutes is where we talk about take-home messages. What is the parent and the people around the parent, around the child. Is that whoever looks after them every day, granny? Is it the house girl? Is it daddy? Is it mummy? Is it a nursery teacher? What is everyone going to work as a team to do for the next week before I come back to see the therapist again? What am I going to do? Now, those take-home messages are absolutely crucial. So that's what you and the therapist should be talking about for the last 5 or 10 minutes. And it's not the therapist telling you what to do. It's you discussing together, and the therapist will be asking you, what do you think you could do? What would you like to practice with your child? And that's one of the most important things that you can do. What can I expect during an AVT session? Well, usually expect play. We play. That's how a child learns best. Play is a child's work. Play is a child's work. So we usually use play. We use books because I love storybooks. Books is perfect. Looking at books, cooking lunch, washing a doll, all sorts of things you can use. Chopping a banana, peeling a banana, chopping a banana, doing whatever. That is also can be part of a therapy session. But as I say at the beginning, we talk about the goals, and at the end, we talk about the take-home messages. And how do I know my child is learning? Oh, good question. Good question. Well, I think we look for response. And that is something we're very bad at as adults. We talk too much and we're not watching and looking at our child. And the parent is very good at judging this usually. They can usually tell if a child is responding. We need to pause and wait and look. And the idea that a child will show us is something that I have learned very much, because the child shows us whether they're learning. I hope this is helpful.